Okay.
Okay.
So, with us discussing like how we did, like first of all, I feel like you did well. Um, I felt like you were very understanding and um I felt like you listened well and you reiterated back what I was saying and you understood where I was coming from. And I also liked that there was even a moment that you didn't quite get what I was thinking correct, and I corrected you, and you were like, go with the flow with it. Like like, and I think that's something that's really important for counselors is that it's not a personal attack when you're not getting it right. That's the whole purpose of us asking these questions and reiterating to ensure that we're on the same page. So I think you did well with that. So that when we weren't on the same page, I got you on the same page, and then you followed through with that, and we're then understanding. So I think that
Thank
was
you.
really good. Mm-hmm.
Yeah, and like you said, I felt like I was kind of rolling with the punches. I guess maybe I was expecting someone who was a little like closer to the danger of like self-harm. And then when I kind of like discovered really towards the beginning that even though that was maybe like somewhere on the table, it wasn't really near. I kind of like switched lanes and kind of just try to suss out what your character kind of like needed the most in that moment. And I just I guess I just kind of felt like, you know, the suicide question wasn't as pertinent as maybe some other things that were like very much on your mind, like relating to the partner and whatnot. And then getting to you, my character was much more distraught, much closer to a self-harm kind of situation. And I think that you handled that really well. So, I mean, you were clearly like very concerned. You're very, with me and trying to get my character everything that they needed. And you saw that I was like in a very despondent, very dark place, and you
Mm-hmm.
helped me through that. And so I think that you definitely formed a working alliance like very, very quickly and efficiently, and that was really well done.
Thank you.
Mhm. And so
Um,
then number, go ahead.
no, go ahead.
I was just gonna say, like moving on, um, with confidentiality, again, I think y- this is something that you definitely did a lot better than I did. I can tell that you've been working in the field because you hit all the bullet points really well, as far as not just having to tell someone if there's self-harm or wishing to harm others, but also anything relating to harming children or the elderly. I think you
Hmm.
also mentioned a few other things that were important as well. So very well done.
Well, thank you. Yeah, that is something that I have to do on a regular basis. So
Right.
I was pretty fluent with that portion of it.
Mhm.
I mean, we have a form that I've got memorized basically here at the shelter. So, I mean, that was like second nature to me. But I think sometimes when, I mean, we're doing a suicide assessment, so you're more thinking of like wanting to harm yourself or others. So I don't think that you were necessarily wrong within that because of the premise of what we came into. But I think it is important to be able to mention those other things because, it's also like neglecting of a child could potentially be harmful to a child. So if this person has, like, say, Max was a single parent and had, no other means and like they're harming themselves in front of the child, like that's something you learn. That is something that they would need to know at the beginning that that's something you have to report. So, um, but yeah, other than that, like I think based off of the assignment, you understood the confidentiality portion.
Yeah, I did my best, and like you said, since I'm not working in the field yet, I don't have that like script down, and it shows. But I'm sure I'll get to a point where
Yeah,
I'll be able to do
absolutely.
that.
Well, and also I think what's also helpful is a lot of times when you're going into a counseling session, you have forms to fill out prior to, and a lot of times those forms the confidentiality is already put in there and you discuss it prior to the session. So I think that maybe not on like a regular basis that always happens, but you will be in a routine of being able to say that because you'll have other clients that you've had to work through the paperwork with. So you'll have it already down pat once you're, actually in the field.
Right. I agree.
Um, I definitely feel like you demonstrated the warmth and the understanding. You were very positive with me. Um, and again, you like understood where I was at. So like, yes, I did mention that, there was potential thoughts of suicide, but I also mentioned that like I didn't have a plan at that point. So you were right. The suicide, I mean, you basically did the suicide assessment without asking the exact words because they were already spoken to you. So with that knowledge, you knew that I wasn't in a place that I needed to be hospitalized or anything of that nature or needed emergency care. So you shifted your thinking and your approach and was more on the empathetic side and just giving me that support that I needed.
Right. Yeah. And something I sensed with Amanda is, she had told me she'd been struggling with, substance abuse for, over 2 decades. It's been, something that she's had to deal with for a very long time. And what really stuck out to me was that like she seemed to really, really want to just get better. And I guess that's kind of the thing that I took as like, this is a person who hasn't given up. They're just like tired of like having to deal with this and they really just want to, rise above it. And so, I mean, that's kind of like the cue that I took to move in that different direction.
Yeah, absolutely. I
But
agree.
I mean, yeah, you definitely had a lot of empathy, congruency, positive regard, all of those things when dealing with me. Again, very different vibe with my character. He was just down in the dumps, like wasn't talking a whole lot, talking very slowly. And so you met me where I was at, and I think that your tone and everything was very appropriate for my character.
I always get nervous with men because I personally work with primarily women. So I
Mhm.
that's one avenue that I really feel like I need to work on because like I don't want my tone to be too soft because I don't want a man to think that I'm like talking down to them or making them emasculated. But in the same respect, I feel like the tone really does make a difference with the empathy because if I'm coming in and I'm harsh, I feel like that might not be as well received. Because I feel like men needs that tender touch, but it's like a fine line between it. You know what I
Yes.
mean?
Yes. No, I absolutely agree with everything that you just said. And I think that's why I'm saying that you did so well with it is that I certainly didn't feel like I was being like talked down to in any way. And I definitely didn't feel like you were being like too rough with me either. I think that you were walking the line really well. And
Okay,
so
good.
I
Thank
think,
you.
yeah, if you do have, male clients in the future, honestly, I don't think I would change much just as far as like your tone and everything, because I think you're in the sweet spot.
Good.
But that's
Thank
just my
you.
2 cents. Yeah.
Thanks. That makes me feel better.
Mhm. Yep. And counselor was aware and acknowledged client immediate needs. I mean, yeah, my character had a lot of immediate needs. I mean, it was clear that Max should not be by himself with what he was going through, and so you saw that pretty early on, and you made sure that help was going to arrive, and yeah, you explained that I was in like a sort of situation where that needed to happen, and my character Max was open to that, and admitted like yeah, like I probably need to go
Mhm.
somewhere because it's gotten to that point.
Mhm.
So
I
that's
think
good.
the only thing that I lacked there is after reading the suicide assessment paper, after we got off of our thing, it said about staying with the client.
Right,
And I was like, oh crap. I just relied that you were telling me the truth that your mom was there, when in
right.
actuality, she could have not been there. And then you could have ended it before the people came. And I feel like I dropped the ball there. I feel like you needed either I I needed to ensure that your mom was there and you were comfortable and safe with her and that she knew the situation, or I needed to stay with you on the phone until help arrived. I think that's the only thing that I think I lacked in that moment because
Mhm.
that small amount of time could have been the most valuable time, um, or the pertinent time for you to potentially hurt yourself.
Mhm.
So,
Yeah, I do agree with that. And that's something that after reading afterwards, like I was just like, oh yeah, like I guess there was that thing. But I agree that there were just some variables that made it so it didn't like stand out as much. Like if I would have been home alone, I think
mhm,
that you would have known to do that and you wouldn't have like even second guessed it.
right.
And I think that it was pretty clear that my character was very forthcoming with like
Mhm,
all these other pieces of information. Like he wasn't really hiding any of his cards. He was just putting them all on the table.
yeah,
So I can just see why, it would have been easy to just forget about like staying on the line with him because it seemed like he was telling the truth with everything else and like being very
right.
open about his substance use, what it's like with his friends and why doesn't want to like tell them certain things, you name it. And so, yeah, I guess there's always a chance like he could have been up in his room, his mom could have been downstairs. I mean, just that little bit of distance, something still could have happened.
Yeah.
But I don't think it was like a big miss. It's not like you knew that I was home alone and you were just like, help is on the way. You know what I
Right.
mean?
Good luck
So
trying to figure
it
it
was a bit
out.
of a bit of a gray area, but you're right. I mean, I guess there was like that space where something could have happened. So
Yeah.
yeah.
Um, okay. So the counselor used a direct approach to ask if the client was suicidal or immediate risk to herself, himself, or themselves. So for Amanda, I feel like I made it known that I wasn't at immediate risk to you.
Right. And I did
So,
come out and say that. Um, and I suppose that's why I didn't feel the need to ask. But if being like having that direct approach and just asking up front is kind of like part of the thing, then I definitely missed some points there. But yeah, you did say so on my end. With Max, you did say very directly like, are you thinking of suicide? Have you made a plan? So I think you did really well with being direct with my character for sure.
yeah, and I feel like I also even tried to pad it a little bit. Like, I'm going to ask you a direct question, and I don't mean
You
to
did.
offend
Hmm.
you. Um,
Yeah. It was direct yet still like soft and caring. Again, I think, you were good with walking the line there.
right.
Yeah. And then as far as like asking appropriate questions to understand the severity, yeah, I think again, like, when I was the counselor, it wasn't as direct because I think you were kind of revealing some information so that I didn't really need to ask as many questions. Whereas I think with you, um, Max, my character, was not as like forthcoming, and so you were really good about like asking those pertinent questions to like really get to the bottom of how I was feeling, what I needed in the moment.
Right. So I think also with that, um, so I know we were supposed to do 20 minutes and
Mhm.
um I was I looked back at it when we got off and I was like 16 minutes and some odd seconds.
Okay.
And so then I thought about like, could I have asked more questions? And was there something that I missed? And I feel like I don't feel like I did. And I know it was a short period of time, but I feel like looking back at it now, like I don't think we really needed more time to ask those questions. I found out pretty quickly based off of your demeanor and the things that you were saying that you were in immediate risk and you needed something then and there. And I feel like with men, it's like, and tell me if I'm wrong, but I feel like with men, they want to see results immediately as best as they can because when they're ready, they're ready. And if you
Mhm.
him haul around it, then the chances of maybe they might feel like, oh well, she's not picking up what I'm putting down, basically, and like maybe could change their mind. Like I feel like men are more direct than
Mhm.
women are. So I feel like although I probably could have asked more questions, I feel like that would have been more of an annoyance to you because like I feel like as a man you would have been like, I already done told you what I need and what I want without directly saying it. And you're just beating around the bush asking me more questions that you don't need to ask me. Like you know what I
Right.
need.
Yeah,
So I like I said, at first I was a little disappointed about the 16 minute situation because of our 20-minute requirement. But I think that it was warranted where it's at, and I don't feel as disappointed anymore. And I may get points off, but I think that it was the right decision to kind of just bump through it.
I agree. And I think, yeah, I mean, we moved through everything and we covered, I think, everything that we needed to, just like you said. And then I guess the only thing that may have like been covered in those last few minutes is just you staying on the line with me while like help arrived. But that wasn't really necessary since, this was, just like like a mock scenario.
Right.
But yeah, during that time, I think it would have just been you like making sure that I was okay. I don't know if like any other like topics needed to really be discussed.
Right.
So yeah, I agree with you. Let's see. And then as far as like a plan for suicide, again, yeah, you asked me about that, and then my character told you about how they had procured the rope and how they had attempted once before with that kind of method. And so again, that was the big tip off that, you know, I was there and something needed to happen. So
Yeah. Yeah, and again, for me as Amanda, I straight up told you I don't have a plan. I feel this way sometimes because I don't feel like I'm good enough. And then I did say like if the relationship didn't work out, it would definitely happen. You know what I mean? So um I don't really feel like there was a need to ask if there was a plan because I told you there wasn't. And at that point I was in the relationship still, so that wouldn't have been like the highest concern as a counselor, in my opinion. It would be more so like what you did is getting me what I wanted and needed, which was to get better, not using drugs, and to try and feel normal and learn how to be who I wanted to be with this person. So I think
right.
that you were great with that.
I actually do want to ask you though. So like, yeah, everything that you just said, I agree with. And as long as you have that, your character had that relationship, you weren't really close to considering suicide, but I guess potentially that relationship could end at any time, and then all of a sudden you're in that very critical category.
Mm-hmm.
How would you handle it? Because like I really have no idea. Like how would you handle that where like, someone is okay, but then there's this thing that could happen at any moment that would all of a sudden make them not okay. Like how do you account for that or how do you move forward with, you know?
So I don't have a lot of experience with um like someone coming in with suicide since we're primarily domestic violence.
Hmm.
We don't do a lot of like mental health with me not being licensed and stuff. So I primarily do like relationship counseling. So I think it's hard for me to fully answer that at this point because maybe as a licensed counselor, I would maybe be more in the mental health realm and have the answers for that.
Mhm.
But for me at this point, like in what I'm doing now, I wouldn't like ask furthering questions. My main priority would be because it's kind of a moot point at that minute because it's not happening. It's not something in that moment. So I would, just hope that this client continues to see me and that if something does go awry, that I would be able to pick up on that and go from there. But so I don't know how to really answer that. I mean, maybe that's a question for our professor.
Yeah. I mean, the only thing I could think of is just to maybe make double sure that you provide them with like numbers or contacts where like if something does happen, they can just hopefully
Yeah,
like call right away so that if, they do become critical that they get the help they need and they don't,
yeah. Or
yeah.
maybe even ask about supports, like, because I don't think we really got into that much.
Right. Yeah. Yeah. And I think that's one thing that I definitely missed is that I should have talked more about other supports other than just the significant other that like Amanda was seeing. Because I don't think that I talked about that much. Or if I did ask, I think that there just like weren't many other people in like Amanda's life. So,
Yeah. Yeah, I can't remember if you did ask. You very well may have asked. Because I remember us talking about the fact that, my dad was using my mom didn't support me. Um, and I didn't have friends.
right.
So you might have asked. But then that's still so then maybe a follow up of like, well, you know, but I don't know. You did talk about me going to group therapy and things like that for
Mm,
supports. So maybe just following up with that and ensuring that I have those, and then
right.
seeing if I'm going like in the future
Yeah.
develop those supports. That's the only thing I could think of.
Mhm. Okay. So let's see.
So
And we
we
kind of covered, go ahead.
I was gonna say we both did previous attempts. We
Yeah.
talked about that. Um, I don't feel like I had a traumatic event, Amanda, in the last 2 months. You did.
Well, again, I think it's kind of great because I'm pretty sure that I said like 3 months ago. So technically
Okay.
I didn't. But I mean, that's so close that I guess like you could probably count that.
So I probably would have counted that because
Yeah,
like 3 months ago is when the traumatic event happened. However, the last 2 months is probably when you started feeling those traumatic events fully.
true,
So
true.
I would have utilized that. So, I don't even know if I really like that particular
Yeah, it's
phrasing
kind of
for a risk
arbitrary.
factor
Yeah,
because it doesn't matter when the traumatic event happened. It matters as to when it's affecting you, to be honest,
right.
and what's happened that made that effect. Because it could have been a traumatic event a year ago and something happened that wasn't necessarily traumatic, but it brought back all these things that had happened to you then that you've worked through, and now you're trying to have to work through it again or what have you.
Right. Yeah, I agree. I mean, something could be extremely traumatic and happen 10 years ago and, be more significant in the moment than something that was traumatic, but a lot less so that happened like a week or two ago.
Right.
So I agree. It just all depends.
I know that we both had family issues.
Hmm.
Um, you had lack of purpose and unemployment.
Right.
I don't think I did. We didn't talk about employment for me. But I feel like I had purpose. I didn't
Hmm.
lack it
Right.
because my purpose was my boyfriend and having the life I wanted.
Hmm. Yeah, and again, I think your character reiterated time and time again that like they really wanted this relationship. The person was like treating them well, things were going really well. It just felt like they had this hurdle that they've been struggling with for decades. They just really wanted to overcome that, and then they'd be in like a much better place and not
Mhm.
in danger of like losing the relationship since that was a very important thing to the significant other. So
Right.
yeah.
And then social isolation or withdrawing. I don't think I had that. I feel like I was
Yeah,
always like I wouldn't say I was in isolation. I just didn't have anybody.
right,
So I wasn't withdrawing from anything, any person, I mean.
right. Yeah, yeah, you had pretty limited like social connections, but I agree, you weren't like purposefully like moving away from people that like you should have been like closer to. You were kind of just, in this spot where you were, you hadn't been in contact with your family for some time. You had this boyfriend, and that was kind of your world. And then on my end though, I had many more social connections, but none of them were especially close, like whether it be like the mother, um, I don't know if I mentioned siblings or not. I think I did. And then friends who, I kind of told some things to, but like not the things that were more difficult. So I think
Right.
that my character was definitely withdrawing a lot and feeling isolated, and you picked up on that.
Mhm. Yeah. Yeah, no, I agree. Um, and I definitely feel like you lacked problem solving. Um, and
Yeah.
we didn't really talk about like anything that you utilized to cope. I mean, you were in such disarray, I feel like that, I mean, that was not even necessary to talk about because like I felt like we just needed to get you stabilized before
Yes.
any of that.
Yeah. And I think Max even said like straight out, like, I'm beyond the point of like being able to help myself. Like
Yeah,
no matter like what tools you give me, like I cannot do it on my own. Like I'm just
right.
kind of I've completely given up.
Hmm.
Um, but yeah, and I think your character was similar as far as like the substance abuse was concerned. But yeah, I think that yeah, Amanda had a lot more like resolve to like work through things. She definitely had the capability to do a lot on her own, even if she did, struggle and keep relapsing into like the, alcoholism and drug use and whatnot. And so that's probably something that I should have talked with your character a bit more about is just like things that she could do, on her own
Hmm.
before, during, getting in touch with those other people and
Yeah,
trying, like make those social connections with others who are going through the same thing.
yeah. No, I
Yeah.
agree with that.
Mm.
Um,
And hopelessness. Yeah, I think there was a lot of hope with your character, with Amanda. But yeah, not much hope with Max. And yeah, again, you saw that. So
yeah, yeah. There I just kind of
yeah,
go back to like we needed to stabilize this client before anything. Like, because nothing that I could have said would
Mhm.
have been helpful in that moment. Like, literally, what needed to be done was stabilization in some form, with hospitalization, in my
Yeah,
opinion.
yep, yeah. And he needed to be like in physical proximity to others because any length of time, like being left alone, would have been a very bad idea.
Right. So just so you know, we have 10 minutes left and then our meeting will end. I'm not sure how long our recording is at this point, but I don't feel like
Okay,
we talked long prior to recording.
okay.
So,
In order to save the recording, do you need to like save it before the 10 minutes expires?
um, don't know the answer to that.
Okay. Do you want to like set a timer for like 8 or 9 minutes? We can Actually, I can do that. I can do it
Okay.
right now. Okay. I'll let you know when we get to 8.
Okay.
Okay.
So I don't
Um,
think we really talked about physical or mental illnesses.
no, not really. I mean, other than just, I don't know if you can consider like substance abuse kind of like a illness. I know some people regard like addiction in that way,
Yeah. Yeah, we
but
both struggled with addiction. So I
yes,
would surmise that there was some sort of, 9 times out of 10, somebody with substance use disorder struggles with some sort of mental health issue. So we could probably surmise that there was some sort of mental health issue along with, um,
sure.
we just didn't talk about it.
Yeah. And I think both Amanda and Max, there were definitely things that happened like in their childhoods, like with parents or, you name it, that kind of like
Yeah.
put them on this path. So
Yep.
yeah.
Absolutely.
And then impulse control, again, I mean that kind of goes along with like the substance abuse, I'd say. I
Yep.
think both our characters were using like the drugs and the alcohol as a means to cope with what was going on.
Right.
So they weren't good coping mechanisms, but that's what they were doing.
Yeah.
So
You definitely had access to the lethal tools. You went and got that stuff.
yep,
So,
I went out of my way and I
yeah.
got the stuff. And again, like that's a really big red flag. Um,
Yes.
and I had told you that I had attempted once before.
Right.
Um, and then I guess like Amanda also said the same thing, although what it was like over a decade ago.
Yeah.
Um, and it was like an overdose. And so it was one of those
Yes.
situations where she attempted but was saved.
Yeah.
And I
And I
think,
wasn't using at that
right,
point. I was 2 weeks clean.
right, yes. And so that was another kind of green flag for why,
Hmm.
you weren't as much in that danger zone as Max was.
Right.
Yeah, so we talked about drugs and alcohol,
Hmm.
lack of responsiveness to counselor. I think Amanda was very responsive. Like she was very, with it. She maintained eye contact, all of that. And again, it was not the same with Max. He was looking down a lot, looking away,
Yeah.
talking slowly, not talking much.
Hmm. Yeah. However, I think it both clients were responsive to the questionings and things like that though. So, and we're forthcoming. Um, so I think that was good in that aspect. Even though there wasn't that for Max, there wasn't a lot of verbiage, but it was enough to give what the counselor needed.
Yeah, he was answering all of your questions. Yeah, I
Hmm.
guess that's the main thing with responsiveness. So yeah, you're right. Um, Persistent suicidal ideation. Uh, yeah, it wasn't there with Amanda, but it was definitely there with
Hmm.
Max. Yeah.
And then you definitely
And
verbalized a plan for suicide.
mhm, yep, yep. And your character did not do that.
Yeah.
Yeah,
I mean, I did, but it wasn't something that was going to happen right then. Do you know what I mean? Like I was not
right.
in the risk factor of it. It was just like, well, if this happens, I probably won't make it then. You
Yeah.
know, there was nothing, no basis on it at that point.
Mhm.
So again, I think that is something we should maybe consult with the professor about. Like what would you do if somebody did say that? Because they're not at risk at that point, but it only takes a day for them to
Yeah.
break up. And then what? Like, what if they don't come back? Like, then like, what do you do? But
Yeah.
maybe it is like what you said, like giving the numbers and, developing a safety plan should that happen.
Mhm. Yeah, and I think that when you said that like, you would if like there was the breakup, I think that is when I should have said like, do you have a plan for suicide? And like ask that direct question. So I
Yeah.
think, if there's something I would have done differently, I think that's like one of the bigger things I would have done differently is I think like that's the time to, talk about that. Even if you're not considering it at the moment, like, okay, let's say that the breakup would happen, like, do you have a plan for like what you would do
Right.
to take your own life? So
Yeah. I
yeah.
agree.
And then protective factors. So I know with me, the thing that I was like focusing on, I think was just trying to get you connected to like other people that
Mhm.
and trying to get you those social supports since it didn't seem to me like you had many outside of your boyfriend.
Right.
Uh, but yeah, I didn't talk as much about like, faith or I don't know, maybe some other things. I don't think we talked about children or anything like
No,
that.
no.
Yeah.
And same with Max too. We didn't talk about those things.
Hmm.
But I don't feel like they were as pertinent
Yeah.
with when we were talking, but maybe I'm wrong.
No, I agree. Again, he was just like at that point where, yeah, I mean, he needed to see some professional help and, you know, go somewhere. So,
Yeah. And then I don't feel like we really had many valuable relationships on either end per
mhm.
se. I mean, you had friends that you conversed with, um, and you did live with your mom. So, but you said about the relationship was combative. So I don't know if you necessarily would have felt like that was valuable to you in that moment.
Yeah, I agree. And since it was combative and since, yeah, it didn't seem like Max really had anyone who he was really telling everything to. He was kind of like hiding a lot.
Hmm.
Yeah, the social resources were minimal.
Yeah.
Yeah. And yeah, I think with Amanda, she had the one really good social resource that, one of the best for her and everything, but again, maybe it would have been difficult for her to really, talk with that person because especially if she relapsed, like that's the last thing that she would want to tell them. Like, there'd
Right.
definitely be some hiding things going on there.
Right.
So,
Absolutely. I agree.
yeah.
And then again, we already kind of discussed this. I don't feel like I did right with the conclusion of the suicide assessment. I mean, I did, but I didn't. So, you know, I definitely think that it was good that I got you help, but I should have waited with you.
Yeah, and I think, maybe that's just like the one thing that you would do differently there, just like I would
Yeah,
do differently. Like asking about like the means or like if Amanda had like a plan if things did go south.
right.
So I think those are the two things that we would probably do a little differently. So it's been eight
Yeah.
minutes. I don't know if
Okay.
it's gonna end soon,
I
but
think this was good, and I'm excited to see how things turn out. And we definitely need to ask the professor about that question. So maybe I'll send him an
yeah,
email.
okay.
Okay.
Awesome.
Bye.
Bye.